Hello everyone. Today we are going to say about a little important topic which is synovial joint. The synovial joint, as we are familiar with this, because this joint is responsible for the most of the movements of the human body. So it is actually the most evolved and therefore the most mobile type of joints in our body. It has certain characteristics. Let us see a few important points together here. The first, it is the articular surface of the synovial joints is actually covered by an hyaline cartilage like clavicle and the mandible. The articular cartilage is avascular. This cartilage is actually the avascular, non-nervous and elastic type of cartilage. So the synovial joint is actually lubricated. Lubrication is by synovial fluid, the cartilage which provides a slippery surface for the free movement of the joints, which resembles like ice on ice movement. So which is provided by the synovial fluid, which helps in the lubrication of the joints. Then the surface of the cartilage shows a fine undulator filled with the fluids. Between the articular surfaces, there is a joint cavity filled with synovial fluid. We already know that. The cavity may be partially or completely subdivided by an articular disc or meniscus. So it makes us a complex joint actually. The joint may be surrounded by an articular capsule, this is most important, which is made up of fibrous capsules lined by synovial membrane. An important point to note here in this synovial joint is actually the cartilaginous part. The articular cartilage, which is avascular and non-nervous thing, but here we have to remember the fibrous capsule, which is richly supplied with the nerve supply. The fibrous capsule supplied with a rich nerve supply, so that if in case of any sprain or any injury or any other trauma case, any other disturbance to these joints, these fibrous capsule, in lieu of a lot of nerve supply, it protects the joint by a reflex action. So this is called watchdog action of capsules. So because of its rich nerve supply, the fibrous capsule is sensitive stretches imposed by movements. This setup appropriate reflexes to protect the joints from spraying. So this phenomenon is called watchdog action of the capsules. So the synovial joint is actually classified into 7 types, that is plain, hinge, pivot or trochoid, condylar, ellipsoid, saddle and ball and socket spheroidal one. So let us see a little more detail about these 7 types of joints in the synovial joint. So let us discuss about the types of synovial joint. First is plain synovial joints. So from the name, this suggests that the articular surface is more or less flat, that is plain. So that the name comes as plain synovial joint. So due to the flatness of the articular surfaces, they permit gliding movement in various directions. That is the gliding movement. So examples of these joints present in our body is intercarpal, intertarsals, intermetacarpals and intermetatarsals, and sacroiliac joints and costovertebral joints. These are all the plain synovial type of joints. So the second one is hinge synovial joint. Hinge synovial joints, here the articular surface is pulley shaped, so they are strong collateral ligaments. So these are strong collateral ligaments. So movements provided in one plane, that is transverse axis direction, one plane movement. So the joints present in areas such as elbow, ankle, interphalangeal joints. So the third type is pivot joint or trochoid joint. So in its articular surfaces, it comprises a central bony part. So bony pivot, that is a peg-like structure which is present, surrounded by an osteoligamentous ring. So the ring and the bony pivot central part is present in this pivot joints. So that it comprises of a movement, that is it is able to move in one plane, that is vertical axis. So examples of this joint is superior and inferior radioulnar joint. So superior and inferior radioulnar joint and median atlantoaxial joints comprises this pivot type of joints. Median atlantoaxial joint. So this is all about the pivot joint. And let us going to see about the condylar type of joint. So it is actually bicondylar. In its articular surface, it includes two distinct condylar surfaces. Two distinct condylar surfaces. That is like this. If suppose this is, we can come across this type of joints, right? Synovial type. So in this type, this is our upper and this is our lower one, which is convex, and this is concave. So this resembles a convex male surface. This is called as a convex male surface, and this is called as concave female surface. So this comprises the condylar type of synovial joints. So the articular surface includes two distinct condylar, that is one convex male surface and the concave female surface. So this comprises a movement of one plane in transverse axis. This type of joints present in knee joints and temporomandibular joints. This is all about the condylar joints, and let us see about the ellipsoid joints. In its articular surfaces, it also includes the oval convex male surface and the elliptical concave female surfaces. So it can able to move in both directions. So it can able to establish movements like flexion and extension in the transverse axis, and abduction and adduction in the anterior-posterior axis, and circumductions can also be provided by this ellipsoidal type of joints. So examples are atlanto-occipital joints and wrist joints and metacarpophalangeal joints. And finally, the saddle joint and the ball and socket joints are going to be discussed. The saddle joint is actually, its articular surface are reciprocally concavo-convex. That is reciprocally concavo-convex. So the saddle joint movements is actually similar to that of the ellipsoidal joint, but in addition it possesses some rotation which cannot occur independently. So that is, the articular surfaces are reciprocally concavo-convex, and the movements are just similar to that of the ellipsoid joints, with additions. In addition, some rotations around the third axis which cannot occur independently. So the examples are between femur and patella and sternoclavicular joints, and the first carpometacarpal joints. These are all saddle joints. And let us see about the ball and socket joint. This helps in a wide range of movements actually. Its articular surfaces commonly include that female and the male surfaces, that is globular head, that male, and cup-shaped female surfaces which we possessed in the articular surfaces. So the movements is actually, it have a wide range of movements, so that occurs an indefinite axis which have on common centers. This provides flexion, adduction, extension, abduction, lateral and medial rotations are going to be performed by this ball and socket type of joints. So examples are hip joint and the shoulder joints. So finally we have completed the synovial joints. So support us and subscribe for more videos. Thank you.